Welcome to Outdrive, folks. I'm your host, Cliff Callis, and each week I'm bringing you actionable marketing insights you can apply to reach, connect with, and convert rural American consumers. Outdrive is powered by Callis, a full-service advertising agency with a focus on marketing rural America. Callis offers a wide range of integrated marketing services, including website development, search engine marketing, social media, video, and digital. We develop strategic and creative campaigns to build your brand and your business, and you can learn more about us at ecallis.com. Now join me in the front seat as we head out on the road to success. Let's go. Hey folks, welcome to Outdrive. We've got another great story to share with you today about life and work in rural America. You know, somebody asked me the other day, why do you do a podcast anyway? Well, there's lots of reasons. But one of the big ones is because I truly believe that many people don't have any idea what it's like out here. I want to educate people about what rural America is all about, our lifestyle, the kind of work we do, the way we have fun and enjoy our lives, and the people who live here. And that brings us to our guest today. Marvin Smoot is the Vice President of Clinic Operations for Bothwell Regional Health Center, a hospital and clinic group that provides quality health care to the people of Central Missouri. I think one of the misconceptions about rural America is that the quality of health care is not as good, but I beg to differ. We have experts with a range of expertise and experience who were trained in the same schools as those living in the city. They've just realized that life in rural America is pretty darn good. Keep listening as Marvin and I discuss Bothwell's approach to serving its communities, how they're telling their story, the challenges they face, and some of the innovative things they're doing to take care of our friends and neighbors. Welcome to Outdrive, Marvin.
Hey, thank you, Cliff. Thank you for having me.
Well, I've been looking forward to having you. You and I always have some great conversations, and from what I know about you and the things that you're involved in, you've got a really great feel for healthcare marketing. I think you know healthcare marketing and you take a common sense approach to it. So I want to hear some perspective on that. Providing healthcare in a rural setting presents some unique challenges. So I want to talk about that because I know people will be able to relate to that are in healthcare marketing. And then let you talk about some of the things that you're working on right now and hot buttons for you. And there's lots of ways we can go. But before we go down any of those roads, let's start by having you just tell us a little bit about yourself.
Well, thank you very much. And again, I'm excited to be here. And anytime we get to talk about my passion, that's the delivery of healthcare in rural markets, but just the delivery of healthcare, I get excited about it. I've been in healthcare leadership for about 17, 18 years now, but I really started my journey as a school teacher. I wanted to be a school teacher in college because I wanted to be that coach. I wanted to be that person that's there to mentor people and bring them along. And interestingly enough, I found that I could do that in healthcare. But, I've been in healthcare. I was the director of the South Dakota Lion's Eye and Tissue Bank back in the late 90s, early 2000s. I was able to train at the Mayo Clinic, the University of Florida tissue banks, really got a lot of great experience on that side of it. Really took an entrepreneurial bent and built daycare centers in Sioux Falls, South Dakota that my sister has now and really able to serve families in a unique way. And at one point I wanted to be a physician and I spoke to one of my orthopedic doctors because as a football player, I got to meet my orthopedic surgeons often. And I said, golly, I'm going to take my MCATs. And he looked at me and he said, I hate being a doctor. I said, what? He goes, I hate being a doctor. And this was on the advent of EMR and call and all the things that, they're talking about. And he said, go be Kelby Krabenhoft. And Kelby Krabenhoft at the time was the leader of Sanford Health in Sioux Falls, South Dakota. And while he may have had a less than great retirement because it was around the COVID time and it was challenging for everybody, he was an administrator of a rural program and a rural network. And it was one of those things I aspired to be. And so I was able to, like I said, I went into healthcare leadership, starting with specialty practices, building ASCs, multi-state sites. I worked for a large organization called Common Spirit Health, which is about 150 hospitals with 150,000 employees in healthcare. And you learn to navigate a healthcare system. And ultimately, again, there's restructure and all the things that go on. I had a recruiter call me and say, why don't you come down to Bothwell? And I said, what the heck is a Bothwell? And I started laughing. And I shared the story because, I can tell you what a Bothwell is. It's somebody that acts with integrity, somebody that has care for the patients at the forefront of their mind. It's somebody that works with joy. That's what a Bothwell was. And I made the choice to move here to lead as the vice president of clinic operations in November of 2024.
And we're glad you're here.
Well, thank you. I'm glad to be here.
I know that many of our listeners, or at least some of our listeners, probably know about Bothwell Regional Health Center. But for those who don't, give us the elevator speech for Bothwell.
Well, again, my lens is that Bothwell is a rural health center. It is not a critical access hospital, and I've worked with many critical access hospitals. We're about a 100-bed hospital located in central Missouri. We really have serve 8 counties, but we're primarily located in 2. That would be Pettis County and Benton County. We have about 19 clinics, and we have over 100 physicians and APPs on staff here. What's unique, I think, to Bothwell, especially when you look at a community of about 25,000 here in Sedalia, is the specialists that we have, from the pulmonary specialist and wound care, dermatology, family medicine, orthopedics, general surgery, neurology, pain clinics, which is not only interventional, but helps manage panels of people that are on pain medications. That's a big challenge to overcome in rural communities. Again, internal med. There were so many things that really stood out to me from a rural community to have access to so many different specialties. We have cardiology. And while it's not interventional cardiology that a lot of people think about, you still get the great level of care by coming into Bothwell. So for me, it's an organization that provides great support to this community, great support to the state of Missouri, has a great partnership and residency with MU, but really looks to offer the best care locally.
Well, and we're very fortunate to have such a comprehensive healthcare organization in our community. A lot of small towns like ours doesn't have a hospital anymore. And it's an important economic driver, certainly a big employer. But from a quality of life standpoint and a business recruitment standpoint, it's critical for a community our size to have one. So thank you for everything that you do and everything that Bothwell does. You mentioned that you were the vice president of clinic operations, and I know what you do. But I'm thinking that there's probably some people out there that are wondering, what do you do?
Well, I'll tell you, I think even my direct reports say that, but no, a vice president of clinic operations, it's a role that resembles the chief operating officer a lot, because I have the ability to support physicians and APPs, nurses, other clinicians, whether they're in the clinics or whether they're hospital-based clinics. So what happens within the walls of our hospital doesn't stop it. Then we all of a sudden have this different approach in our clinics. What I get to do is I get to work with a leadership team that really promotes access within our community, that is looking and striving for the ability to treat people in the right location. And what I mean by that is, I don't want people walking into the ER. It's one of the most expensive and it's one of the most drastic places to go. And what we do is we focus on access in our clinics, so that way patients can be seen for their hypertension. They can be seen for A1C. They can be seen for acute and chronic injuries. There's a lot that can be done. And what I try to do is coordinate that by creating operational efficiencies, looking at what we need to do from a strategy standpoint in recruiting, hiring and developing leaders, and creating succession plans, and then promoting the care that we have. I fortunately get to work with your team in a lot of these areas. And I am what is an ENFP. And if you know what that means in Myers-Briggs, that means that I love being that big picture thinker, that big picture coach, but oftentimes I'm hard to rein in, and you might hear me get off during this podcast too about it. But, I've been able to work specifically with Dana and now with Josie out of Calais, and they've been able to take these big picture ideas I have about what the next thing we can do in our practice, or even what the appearance of our practices should be, and really bring me in. And again, that's a critical piece when we think about the marketing, because my desire is to have people be able to walk into any Bothwell clinic and know they're in a Bothwell clinic. So that means signage needs to be the same. That means that the care needs to be the same, that the check-in process needs to be the same. Because when people are coming to us, oftentimes they're in a very vulnerable state. So if they can feel comfortable knowing that they have quality of care every single place and it looks the same, kind of like when you walk into your home, you know what your living room looks like, you feel comfortable there. We're able to create that. And that's what I'm trying to create here within our clinic system.
Yeah, and you're doing a great job of that. And just you should know this that we love clients that are big picture thinkers because nobody knows your business and your organization and your needs like you do. So when you have the big ideas, we love being able to take those ideas, break them up into as many different pieces as we can, and run with them. So we love the relationship that we have with you. You're a great client because you are a big picture thinker.
I'll tell you, to me, there's no better feeling that when I get to limit and 50 and I look up at that board and I see something that we put together that promotes the care services, that promotes the providers, that promotes the employee of the month. And I look up there and there's a level of pride that I have when I look up and I see what we're doing at Bothwell. And it comes from our partnership. So again, I appreciate it too.
Well, we share that pride. We get that same feeling when we see that board. As I think about your role, you're balancing a lot of different things. You've got patients that you're wanting to provide quality care to. You've got providers who have their own needs and challenges. You've got all these employees. You got a marketplace that's changing. You've got to meet all these needs within a budget. That seems like a difficult balance.
It is. And, the financial constraints in healthcare are just growing, even to the point of this year, Medicare's physician fee schedule, and that is how much we're paid for those visits by Medicare was lowered again. And it's the second time that we've seen some major adjustments in that in the 2 years. So it does create those financial constraints. But I really think it comes down to, there is a balance there. There's a balance of the right now. I kind of always say, what's Mr. Right and what's Mr. Right now? And oftentimes, when you look at that approach, you say, this is the right thing, but it needs to be done right now. Or, yeah, this is the right thing, but it doesn't need to be done right now. And I think we have to have very transparent conversations with our physicians, our employees, and our patients. And we have to let them know what we're doing because you'll have them say, well, why don't you have that PET scanner? Well, that PET scan really is only about having care for this subset of individuals. And if we spent $1 million on that, we couldn't do this other type of care. So the decisions to really try to focus on how we can optimize every treatment modality, how we can optimize every piece of equipment is a unique balance and conversation because there's a passion that when people come to me and they say, we need this, there's a passion that I don't want to squelch at that point. That's a passion I want to bring out. But, oftentimes it's yes with an if or no with a but. And let's put a strategy behind that. And again, frequently people say, it's like, okay, we'll put that in the budget. That'll be above the line, meaning we're going to prioritize it, or that's going to be below the line. So if we do these 25 things and we still have money, we'll get to that. And it's not always the best answer, but what it does though is again it opens those lines of communication so that way when people feel confident that you're listening to them as a leader, whether they're a physician, non-physician, or a patient, when they feel that they're being listened to, they understand or they give you the time to try to work your way through it. Now if you just shine them on and say, yeah, oh, I will do that, and they come to you, they say, well, you didn't do that, then again, we didn't act with integrity. We didn't act with one of our key values of making sure that we're respectful to our patients. And so it's a unique balance. Oftentimes I find, and I coach some of our other leaders on, it's like, what do you respond to? Because we don't have to respond to everything. Sometimes people are just saying, hey, I just want you to hear this, or I just want to say this, but I don't need you to do anything with it. And I think that's the kind of the magic of leadership is learning what to respond to. And when people come to you and say, oh, we don't have a PET scanner, then you're like, do you really want a PET scanner? Or did you have one patient that said they had to leave town and you're just having a bad day about this? And it can be that balance. I think, again, from a recruiting standpoint, that's probably where we get our greatest questioning about this balance is it'll say, why don't we have interventional cardiology here? Well, while we have a population that needs cardiology, the actual matter is that if I bring too many cardiologists into a small community, they're actually going to lose their skills, and their skills will lose because they don't have the volumes to continue to drive forward. So I would rather drive to MU and have my ablation done by somebody who does 700 to 1,000 of those things a year versus somebody, that we brought here that is highly skilled, but they may only do 10 of them a year. And so it's having the conversation about that balance.
And that's a tough balance. And that's great perspective that you share. I have to think that your unconventional path to healthcare leadership probably plays a good role in helping you sort through these challenges.
Yeah, and when I think about my path, I mentioned that I was an athlete. I went to college on a full ride scholarship. I played indoor professional football. I did all of these things until I was 40 years old. But I learned about leadership, learned about being on a team. And really that's what healthcare is being a part of a team. And I'll tell people often, I don't provide direct care to the patient, but I have a passion to ensure that those who direct or have direct patient care have every tool and every piece of support they need in the right direction. And oftentimes you'll hear me say, block and tackle. Again, and when you think about that from a leadership standpoint, that means I'm doing the foundational elements to make sure that we have consistency in how we respond to things. And so much of this comes from my education. Again, I went to school to be a school teacher, I have a degree in elementary education, I have a degree in business management, I have a master's of science in leadership, I have an MBA, and I have a doctorate. So I've tried to hone these roads because ultimately I want to serve others and I can serve people through positive leadership. And that's the path that I saw of being a coach, being an athlete. As an offensive lineman, I didn't get the pub, I didn't get the ink around that. But I'll tell you what, it felt really darn good when that running back made that score. And I knew that there was 10 other guys on this field and probably six blocking for that individual that allowed that to happen. And I take that same mentality in my leadership here.
Yeah, that's a unique, I guess, feeling knowing that you're part of a team and working together to be successful. And I think that even going back to youth sports, that ability to play and get along with people and win and lose and exhibit good sportsmanship is a trait that can positively set with you for your entire life.
100% agree. I mentor some leaders that are even outside of this facility and outside of this state. I have mentorship calls every other week with a number of people. And that's part of what I talk about is that coachability. And that coachability is self-coachability as well as coachability from others. It's looking and it's being that intellectually curious individual. And when you think about it, approaching the work that you do that and the leadership that way, I'm curious about how I can serve others. So when you see the research and the work and the reading that I do, even the bent that I have, it's like, okay, how can we serve others? And that's what I try to pass on because ultimately that's what healthcare is. It's serving others. And we're serving others, as I said before, in their most vulnerable time, when they're in pain, when they're sick, when they're scared. That's when we have to step up and we have to be emotionally available for them because, people will react to us with anger. People react to us with fear and sadness. How we mitigate those times and how we encourage them to get better is a big part of, again, the service orientation that we have in leadership that comes down, like I said, for me, from desire to coach to desire to build people. And we hire people that fit within that model too. When you're hiring somebody, you say, hey, what do you think of people? And they're like, I hate people. Well, you probably shouldn't be a nurse then. You probably shouldn't be a nurse. Let's maybe find another role for you. You might be a good accountant. I don't know.
Well, that is, one of the great things about healthcare profession is it is pretty diverse. If you think about all the different things that go into providing quality healthcare, whether it's at the clinic or the health center, I mean, there's a lot of different career paths, right?
Oh my goodness. And I'll tell you, you don't often think about it when you're in the midst of everything, but we partner with Smith Cotton at Sedalia 200 School District, and they have a program that's called Queen City CAPS. And this program allows juniors and seniors to really get out and work within different industries throughout the community. So some are going to Nucor. I've been over to Duke Manufacturing and Black and Decker where they have CAP students, but we every single day host about 30 CAP students, about 15 in the morning and 15 in the afternoon, that are doing exactly what you said. They may be engineers, but they want to see what a building like ours it takes to build it. If they wanted to be EVS workers, if they want to be dietary, if they want to be physicians, nurses, leaders, anything like that, what it takes to run this healthcare system and what it takes to run a healthcare organization is truly people that have every level of education, every level of drive, but what they're doing is they're putting the patients first. And what I always find interesting is that oftentimes we think about physicians or we think about clinicians and they're the greatest level of contact that a patient can have. But, when I'm sitting there hospitalized, I know if my room is hot or cold. So I'm looking at facilities there. I know if my room is clean, so I'm working with EVS there. I know if my food is good, so I'm working with dietary. So not only do we look at the clinical outcomes of that patient, but we really look at, kind of those social factors of what can they really determine. So when we look at the importance of every single department, we do elevate those people who connect with patients, especially on those things that patients know.
Well, I think you did a nice job of kind of explaining all that. I think this would be a good time to take a step back. And if somebody's out there listening and they think they might like to talk to somebody about a career, a position at Bothwell, Bothwell's a big organization with 1,000 employees. How would they go about doing that? What's the process to start that?
That's a great question. I would encourage that for anybody. And quick story, I had somebody that came to me and they said, I want to be one of your directors or managers. And I said, fantastic. Let's see your resume. This person has a master's degree. When you look at them on paper, you have great transferable skills. Now let's make sure you do a go and see because I want you to see really what it looks like. So we're even doing that internally. And what I would suggest is I do believe there's an email on the website, but people could email me directly at msmoot@brhc.org because I would love to work with HR. I would love to work with anybody that's curious so that they can do a go and see. We have many people that come in and go, I'd like to do this job. Is it the right job for me? And if they can shadow for a day, I have a friend that's moving down from Thief River Falls, Minnesota. So that's 12 hours north of here, just south of the Canadian border. And he said, Marv, I'm looking for a new start. And I worked with Mark Doherty in our radiology department so that my friend could do a full day of just seeing if that's what he wants. He came back to my house and he started crying. He's like, that's exactly what I want healthcare to be. That's exactly what I want to do. He was able to really see his calling right in front of him. And so I would encourage anybody that wants to reach out directly to HR. We have a call center number. HR can help you. I can help you. But what we would love to do is anybody who's interested, you got to come and see what it is. And you have to give us a day to look at it because for many, they'll say, oh, it's not what I expected. And for many, they'll go, this is exactly what I want. And I would love to have people have that opportunity.
So you mentioned the billboard and the pride that you get seeing something like that that's been executed well. From a marketing standpoint, what are you seeing hospitals doing today that you think is very effective?
Well, I'll tell you, healthcare is a relationship. It really is a relationship. And anything that hospitals can do to move those relationship forwards is what is critical. Whether it is making sure that you have interviews or bio cards for each physician in APP, you want to seed that positive relationship immediately upon calling, immediately upon that referral. We want to give patients every opportunity to see who's going to provide their care before they have the ability to provide that care. I know I'm working closely with you guys, Dana and with Josie, on physician interviews. What would those look like on our website? So you have this snippet of 90 seconds of Dr. Todd from Cole Camp telling you about herself so that when you walk in, you already feel that connection to that physician or APP because you know a little something about them. We're putting bio cards together, and these bio cards are the introduction to every one of our physicians and APPs, and they're going to be in every single one of our clinics. And again, a physician can say, you should go see Dr. Gabe Anders about this. And here's Dr. Gabe Anders' bio card. You could see that he trained at the Mayo Clinic. You could see all of these things, and all of a sudden you're going, wow. It's a great way to start that relationship in managing all of the people up that are going to touch them along the way. And for me, that is the most effective piece is really finding what we can do to establish that relationship. We're working on onesies and swag bags for, I want Bothwell babies. I want people to know that baby was born at Bothwell, whether it's a onesie, whether it's a blanket, a hat, or all of the above. I want people to feel that connection to Bothwell even after they leave. I want people to see that, wow, that other person went to Bothwell. Because I do believe 100% we provide the best care. And yeah, we're humans. People have good days and bad. But when you look at the overall nature of what we do, it's pretty darn good. And it's the marketing that gets us there to really build that relationship. I know I challenge y'all all the time. And it's like, okay, here's my big, hairy, audacious goal. Let's look at this. And right now it's signage. And it may sound simple, but people have a psychological attachment to their environment and the quality of care that it provides. So if I'm going to a building and it has tired signage and the lights don't work and there's dirt on the floor, I'm going to go, what kind of care am I going to receive here? It's really about focusing on the environment to seed that relationship because, again, there's a KPI, key performance indicator called age of plant. And age of plant is just if you look at the age of your buildings and then any upgrades that you've provided, you want to stay under 9 years. And I think that's the Healthcare Financial Management Association's KPI on there. And so when you look at getting outside of that, people say, well, it starts looking a little old. It starts looking a little, is the care inside there? So we're marketing to create that relationship to match the care that we're providing. And we get there in many different ways, but it's always exciting to have those creative conversations with people.
Well, those are some great insights that you shared there. Building relationships with providers. Certainly, video is so powerful. We see that across every industry with every client. And then I'm glad you brought up signage because for many people, I think it's something that's taken for granted, particularly those people that come and go from the same location every day. And it's kind of like a billboard. If the billboard's up there every day, by the end of 30 days, you're not even seeing it anymore. And you just kind of walk right by it. And so keeping that fresh, keeping it directional, keeping it educational is really important.
And I think people don't realize the angst that goes into, is this sign right or is it wrong? And I'll use the example. We purchased the Van Dyke building there on Brianna Avenue. We converted it to our specialty services. We have dermatology and neurology there. Again, a community our size having full-time dermatology and full-time neurology is almost unheard of. So when I was working with Dana on the signage, I said, I really want the signage to say specialty services. And we talked about, can we put another monument sign out there? Well, nope, there's a city ordinance that you can't have more than one monument sign. It's like, okay, then let's put the one on the building. And I want it to be called specialty services. And we did the one monument sign, we put the one on the building. As patients started coming in, they were like, is this dermatology? Is this neurology? Because the sign out front says specialty services. And for us, it made perfect sense to call it specialty services because ultimately we may bring more services in there or we may transfer services out. So it was like, do we want to have a dedicated sign that says this? And really listen to our patients and our physicians in the building. They're like, yeah, because people are going, I don't know what's really in here. So if you look at that monument sign now on Brianna, we've changed it. It still says specialty services, but it's underscored by saying dermatology and neurology. And that came from direct feedback from our patients and our physicians. And it goes to exactly what you said, the importance of signage, especially in wayfinding. And wayfinding is such a hospital term that I almost hate to say it. But when people need directions or they need to understand where they're at, a good sign says a lot. It says the same thing that you see over at our new women's clinic. We have a new sign out there. We put one on the building. That's the old BFMA clinic. So it introduces people to where they're walking into. And again, it goes back to that relationship, that warm introduction to what you're walking into versus the going, is this the right place? Is key in understanding how we connect with our patients.
Well, and it's easy, and it's not just happening in the healthcare industry, it happens in every industry. There's jargon. It's things that you say in the course of your everyday conversations with other people who are in the same business, and yet the general public may not even understand what that is. An acronym that's, I don't know what that is. And, it just shows you how important messaging is and understanding your audience or audiences and talking their language.
And I have to give you an example of that because we talk about jargon in healthcare a lot and we talk about abbreviations. People don't understand what HTN is. That's high blood pressure. Oh, well, okay, I didn't realize that. But we had a community meeting. We're part of TORCH, which is Transformation of Rural Community Health. We're one of 6 hospitals that are working with community partners to better address social determinants of health. And so we had this big community meeting at State Fair Community College, beautiful room, had somebody from a state organization that came in, and he was going over the platform and he was saying, well, KPI, and using jargon. And for me, I'm like, wow, this is great. But you could see a kind of a, oh my goodness, deer in the headlights look for so many of our community-based organizations that when I got up there and spoke after him, I said, hey, y'all, does anybody know what a KPI is? Do you know what this means? And you saw no hands. And I was like, okay, I said, it's good to know. I said, and I explained to them what this different terminology meant and how it was applicable to them. Because oftentimes our community partners, they're not understanding completely that if they're able to get somebody housing or work with them on their heat, that they're more likely to be able to look at themselves and treat themselves or seek treatment when they're feeling sick versus going, I have nothing else to do. So while we're talking about key performance indicators, our CBOs, our community-based organizations, are thinking of people. And it allowed me to take that jargon and take that kind of challenging language that we use in healthcare and bring it to the community-based organizations. And I'll tell you what, that's what Dana does with me all the time. And again, Dana and Josie now, working with them and working with your team, they take complicated matters of medicine and really help make it simple and make it consumable and exciting for our patients.
Appreciate the feedback. We love working with you. Earlier you talked a little bit about Dr. Anders and his training at Mayo Clinic. And I know that he's not the only one of the Bothwell physicians who is getting the same kind of training as those guys that are at the biggest teaching institutions and major hospitals in the region. We have experts here. But there is this preconceived notion, misconception that, oh, hey, healthcare is better in the city. How do you combat that?
You're so right. You're so on point, and it's so frustrating. I was listening to a national talk radio show, and they said, well, if they were any good of a doctor, they'd be in New York City. And it's like, all right, you know what? When I think of Sedalia and when I think of the physicians that we have in this community, it drives me in two different directions. The first direction is this is an extremely high performing community. This community not only has attracted industry, has attracted business, it's not suffering from the concept of brain drain. And what brain drain is when you have people leave a community to go get educated and then never return. So you see those communities, many of the communities that I served in North Dakota had this phenomenon happen where their best and their brightest were leaving the community. Sedalia is really quite the opposite. And it's one of the things that has attracted me. And one of the things I talk about when I talk about Sedalia is this is a high performing community where we see multiple generations of good physicians coming back. And these physicians, when I think of Dan Woolery and the extensive training he's had, it's really following in the footsteps of his dad. When I think of Stuart Braverman, following in the footsteps of his dad, Dr. Edwards coming to town with the 36 years of training, Dr. Kibbers, and then we're seeing their children and people that are leaving town, and they may not always come back to be physicians, but they're coming back bringing education, experience, and the ability to serve people back. And so when I think of us as a high performing community, that's the first thing I see. Why would I want to leave a high performing community to seek care elsewhere? But then on the other side of it, I go, okay, I understand. And I try to seek to understand when people say that. And it's like, oh, okay. But oftentimes they equate as, well, I got this service at MU. You guys don't have this service. They must be better. And it's like we goes to, again, it's the scalability of that service. We need to be great at every single thing that we do. And I really believe that we are. The level of care, the level of training, CMEs, insurance, everything that we do here in Sedalia is the same as if the physician was at Johns Hopkins, Mayo Clinic, Cleveland Clinic. Gabe Anders is a great example, trained at the Mayo Clinic. We have Harvard trained physicians. We have people from Vanderbilt. Dr. Woolery is from Vanderbilt. We have MU. We have physicians from everywhere. And to believe that there is better healthcare than Sedalia is, again, is a strong misnomer. We have strong access. We have strong specialists. But again, what's so great about those specialists is that they know when to refer as well. And that's the great thing about having that local care, is that a physician here knows when to refer that patient to make sure that they have the care they need.
And I think to take it on one step further, those people are here because they want to live here. They know what a great quality of life we have here, how you get to know your patients and how you get to know people in the community. And you don't find that everywhere. So it's really the best of all worlds because you've got experts, highly trained people that are living a lifestyle that's maybe a little more laid back, a little bit more comfortable, and to me, a lot more enjoyable. It's living in rural America. So, as we start to wind down here, thinking about rural America, when I say those words to you as someone who has lived in the city and now lives out here in the country, what does rural America mean to you?
Rural America is where I want to be. I grew up in the Twin Cities metro area, 6 million people around there, lived in towns of hundreds of thousands all the way down to towns of 1,500. What rural America means to me is it's somewhere that I can go and I can care for my neighbor. I can know the person that's next to me and know what they're going to do to help somebody else. You're a name and a person, you're not a number. We say that from an employment standpoint, but for me, in a community where you want to serve, I called Open Door and said, "Hey, how can I work at the soup kitchen? How can I work at the food distribution center?" And they called right back. And then when you start working there, you're going, "Oh, hey, Bill, how you doing?" You're seeing so many people in a rural community going, "We have to do the right things here." To me, living in a rural community is where I can ask for help. If my wife catches a flat, they're going to stop to help her and not hurt her. It's where I can make a phone call and say, I really didn't have an appointment, but can you guys see me because this feels emergent? And the answer is yes. In rural communities, we look out for each other. We do really look out for each other in a way because we know each other. We see each other, as you said, at the ball game, the Sacred Heart girls basketball game last week. I think we had 4 or 5 physicians there with their families. It's great to see that. I got asked, "Hey, Marv, do you want to come over and have dinner at my house on Friday night?" It's like, heck yeah. I met with a physician today and I said, "Do you want to have dinner next week just so we can talk?" Heck yeah, let's do that. The desire to be somebody's neighbor is so strong in a rural community. And what being a neighbor means is that I'm going to look out for you. I'm going to talk to you. I'm going to support you. I'm going to get you the things that you need. And I'm going to help you when you need help. And I think that's what really defines being in a rural community, but it ultimately defines what it means to lead rural healthcare too.
Pretty good way of life.
Yes, it is. So again, I chose to move here 13 months ago. I moved here from Sioux Falls, South Dakota. Oftentimes people look at Sioux Falls and say, "Oh, that's a rural community." It's almost 300,000 people there in the area. It's not a small community. And I was asked, I was like, "Why did you come to Sedalia?" And I said, I had never heard of Sedalia, Missouri before I was called by this recruiter, but I was coming off of I-70. I'm taking a right to go south on 65. And I see the rock formations and I see the river valleys. And this was in the fall. So the trees were turning. And all of a sudden, I had just the sense of, I belong here. I think that's what you get in a rural community more than you get elsewhere, is that I belong here. And that belonging is really what drives that curiosity, support, and helpfulness that we see in our rural communities.
Well said. And we're glad you're here.
Thank you.
Really enjoyed visiting with you today, Marvin. As we close, what else would you like to share with our OutDrive audience that you think they might find interesting or maybe even inspiring?
Telehealth is on the forefront of my mind right now. We have an opportunity in rural care and healthcare to really take a novel approach to how we support our patients. We are going to start forward on working with Title Care. Title Care is a product that we're going to put out in schools. We're going to put in different rural clinics that will allow for that connection to physicians in a remote location. We can put this Title Care in a school and a child goes to the school nurse. They could immediately connect with one of our walk-in clinic physicians. You don't have to bring that child out of school. Their parents may have challenges in transportation. But what's really exciting is how do we find new and unique ways to connect with our patients, both for our clinical care, but on that social side. What we're finding is that patients are having a hard time with travel. They're having a hard time with food insecurities. They're having a hard time with housing. How do we start connecting with patients on a very different and deeper level that really allows us to support them? And working in Catholic health for so many years, I would say, how do we support them spiritually? How do we support them clinically? And how do we support them financially? And I say it from a Bothwell standpoint is that we never want to lose that spirituality, because I do believe that that's a driver in everything that I do. But what I think is important is to understand, how do we find ways to make sure we're treating that patient from a social perspective, from a financial perspective, and a clinical perspective. And I think the organizations that bring those three pieces together to really make that three-legged stool of support are going to be the most successful ones. And that's a road that we're walking down at Bothwell. And it's one that I'd be happy to talk about in the future, because we're just dipping our toe in the water, but we've developed population health, which informs telemedicine strategies, as well as I said, the transformation of rural community health.
Well, I love what you're doing to serve our region. Marvin, thanks for being with us today.
All right. You have a great day. Thank you.
Thanks. Folks, thanks for listening to Outdrive. I hope you've enjoyed our visit today with Marvin Smoot, Vice President of Clinic Operations for Bothwell Regional Health Center. Come back again next week, and I'll take you down the roads of rural America, where it's heaven on earth.
Thanks for taking a ride with us on Outdrive. This episode is complete, so head on over to ecallis.com for more insight you can apply to help drive your business growth. And be sure to sign up for our free monthly e-letter, Outthink, for even more helpful content about marketing to rural America. Have a great day and keep on driving.